there's two things I think about when we're trying to drive co-production forward. Because the next one talks about asking communities what support they need to have more say. I think there are two ways we can come at it. We can come at it from a sort of a leadership position, and we can ask, and we can help make that happen together with people. We can also try and push the voice up. So try and make sure that people feel they can shout and ask and drive things locally when they want to. And I think to get this really right and to sort of really shift the power more broadly, whether that's in an organisation or in a locality, we almost need to do both. But thinking about some examples really of what co-production is, both at an individual level with older people and then at a group level. And so you've touched on some of these, and I know that the conversations differed around the tables as to whether you were focusing more on experiences of individual levels or group levels. But down the left-hand column, so some of the things is working together to support people to identify your own goals and priorities. Someone said person-centred planning might not be, that it had been identified as not co-production. It could be part of a co-production journey, couldn't it? It could be about these are the approaches that help us hear what it is that the person wants and plans to make it happen. Supporting people around using their budgets and involving people in monitoring and reviewing the quality and coming back and that checking is really key. And that was some of the conversations that happened. We might be sharing the power in making the decisions about how to go forward, but are we sharing that going back and checking that it happened and that it worked for either the person or the individuals involved? And at a group level, we're thinking about working with a range of people. And a really good starting point, which is up here, and which someone mentioned they were doing with communities, I think it was the Age-Friendly Cities, you're asking people in your community what's working and what isn't working. And from that, you're setting the agendas for change. People worry that the group are going to say, ask for the world. What if they ask for the world and we can't give it to them? The processes that you go through, and you do need to be really, really clear, is state all the issues at the beginning. So you might want to co-produce a decision. You might have budget cuts that you're facing. You might have less hours of support. And so you don't want to go in and people are saying, actually, what I want is this and what I want is that. We're not promising to do everything that everyone says. What we're promising to do is share how we manage what we've got now. And so helping people identify those issues and say within that context what really matters to me is, and what really matters to us as a group is, can actually reduces risk of people saying, well, how come I'm not getting that? Or how come I can't have that? Because people understand, you're sharing the knowledge at the same time and the understanding of the context as well. What the donut does is it gets us to think about responsibilities and things that are non-negotiable, but things where we can have judgment and creativity about how they're implemented. And it's drawn when you work through either with an individual or a team thinking about what it is, and I should go and draw it there, but I'll draw it in the air. The middle bit you think about as where we've got judgment and creativity, and around the edge would be some of the things that are really set. What are some of the core responsibilities? So with things like legislation or finances, where there are bits of things that are non-negotiable, the how you do things, you can still co-produce the decisions of how we work within these constraints. I think that's really, really important. We don't say because there is a constraint we won't co-produce. There always are constraints around anything we do. And actually the results that you get from co-producing where there are restraints and jointly sharing how we're going to deal with them can be even more powerful than if there aren't any in the first place, because it helps you think creatively about the how. This was developed, as I mentioned, one of the key drivers in the UK has been the idea of personalisation, of putting people in control of their own plans and their own care and support and how that looks. And part of that was that we were asked to come up with some principles of what co-production is. And these were developed by groups of staff, professionals and older people across the UK, different groups that discussed what they thought it meant. So they were involved in it at the same time, they were reflecting on experiences they'd had, and they said, okay, what we say as a group, what we've agreed co-production is, some of the key principles are these. So people are involved, and this is a really useful way of measuring whether you're doing it as well. People are involved throughout the process, right from the very beginning, where you're conceptualising what the issues are. You might have a broad picture of what the issues are. You might say, we need to look at transport services and how they work, or we need to redesign a particular service, or we need to make a particular decision about how we do something. So you might have the broader thing, but people are involved in saying what the key issues are and agreeing what the purpose is and what you're going to be working towards. They're involved right through designing how you're going to do that, making it happen. So people share responsibility for making things happen. That bit where it goes beyond the planning, people actually have, the power is there within the group to actually do that thing as well, not just to say what they think. And then reviewing whether it's worked, so going back to the outcomes and checking that they've happened for the group. So it's a really, it's a sort of a simple way of us saying, when we were hearing about the age-friendly cities, do people have the power to make the changes where they are and actually check whether they've happened? So there's something about a whole journey of co-production. It's not something you can do quickly. It's not something that just happens, and it can be quite long-term, and you can have different people coming in and out of the process, but that shared voice and that going on a journey together is really, really key. People feel safe to speak up and are listened to, and that's something about people feeling, that is about how we drive leadership and make people feel willing to share. Often you sit down with a bunch of people that you think are, let's think of a support worker. What do you call it? Home care worker? Support workers? Just checking in the language of what we use in the UK. Does that make sense? Yeah? So people that are providing direct support, we might have them, we might have invited people to think about how the organisation implements its strategy or do something, and we've got a group together, and we've got people, and they might be sitting in the room with someone that they support or someone that they don't know but supported elsewhere, and they might be a CEO there and a director. And actually for some people there will be this experience of that other people have power than them. And how we try and shift to make sure everyone feels equally able to speak up is really, really important, because that's part of the whole power sharing. And one of the things that older people said is as they learned and they felt confident to do that, that was really key. It wasn't co-production unless that was supported. We work with the issues which are important to people, so people are in the room making a decision or thinking through something that matters to them and is close to their heart and is about them. And that helps you identify who you might need in the room in the first place. Who does this really matter to, or who is this going to impact? It's really clear how decisions are made. And we haven't set a sort of a rule on this must be a democratic approach, or we're going to have people able to veto, or we have to all have a consensus. I think that's what the group themselves needs to think about. But having real clarity about how are we going to reach decisions together? What are we going to do when there are disagreements? What if different people really don't think this is the way to go? How do we work with that? And so being really, really clear right from the start when you're working with a group is agreeing that with them. That we're not saying that there is a fixed way, and different groups have chosen different routes to making that work for them. People's skills and experiences are all used. So we're picking out those assets, we're seeing what people bring, and we're making use equally of all of those. Some of the really practical things people said matter, and what we needed to consider within the principles of co-production. Meetings, materials, venues are accessible, people can get there, people can be heard, people can understand the communication that comes out. Do we need to adapt communication? There's a lot of practical things when we're thinking about, we need to think about all the individuals that are involved in that particular scenario, and what will it make, how can I make sure that this is something which is accessible to so-and-so who's coming along who's got advanced dementia but wants to be involved and is really passionate around this issue? How do we hear that voice? How do we make sure that person hears everyone else's? And so really there's something about planning and the real practical side of it. And so when we spoke to people that were going through this, well, this is one of the key things that they said really mattered and we had to think about. So it's beyond the ethos to actually making it really an actual thing that sort of planning and practical side of things. And progress, the final one is progress is evaluated by looking at actual changes in people's lives. So it comes back to those outcomes and what is it we said we want to change? What is it people said they wanted to change? What did they want to experience? And I don't know if you find when you're working with supporting people to understand CDC and supporting staff to understand CDC, we have a real tendency to try and measure what actions we've had rather than what impact they've had on the individual. And that's a real shift in thinking. It can take a lot of, but how does the person experience it? Yeah, we did all these different things that we said we would do. Did they make a difference? And that's the key bit. And I found I do quite a lot of work with people as part of the personalisation agenda and training in sort of person-centred planning, person-centred approaches, support planning, and getting that shift to you did everything you said, but did something change is really, really key. Costs and benefits. Everyone, and I think this is something we all face, if we're going to do something new, people want to know, funders want to know, etc. Is it beneficial? Is it cost-saving? What impact is it going to have business-wise? There has been quite a bit of research and evaluation around co-production and what it does. And the Sky Guide, which you've got on the table there, which some of our colleagues were involved in, but this one here does talk about looking at how some of the sort of a research review. But not many evaluations have actually looked and calculated the cost. There are some indications that there can be savings, and that's probably because people have a really creative look when they co-produce at how problems are tackled. So there is a suggestion that sometimes by looking at community options and creatively looking at solutions, we spend less money. There are some indications that happens. However, there are also some cost implications in the practical side of making co-production happen well and having the right people in the room. And so I don't think there's anyone that's quite cracked in research. It might be something you want to research along the way. How do we actually measure the true cost of the time it took for people to be there, the practical sides of it, and what it saved in terms of maybe a new service has been designed and done in a different way, and how does that work? So there's indications that it could save us money, but we don't really know. What we do know is that there are social benefits and there are community benefits. And those are really clearly documented for people that have been involved. But there's definitely sort of more, I can't come and say, here's all the evidence, it's a reason to go and do it. But the experiences that people have when they've been involved in that shared decision making is really, really powerful, and the relationships and the social impact it's had. Some more principles, which didn't fit within that sort of process model of principles which I talked about, which have been identified as being really, really important in co-production, are things around equality, diversity, and reciprocity. So equality-wise, we're saying everyone is equal in the room. Everyone's voice is equally going to be heard. Everyone's opinion is equally valid. In terms of diversity, we need to think we live in diverse communities, in diverse countries. And so one of the challenges is thinking, how are we hearing? If we're talking about a wider community, how are we reflecting in this decision the diversity that exists in this community? Of people from different backgrounds, races, religions, etc. That's really, really key. I live in London, where it is incredibly diverse, and sometimes voices are brought through user-led organisations or organisations that specifically represent a particular part of the community. And those voices can be really important. We can use representatives from organisations. For instance, we worked with a Bengali organisation in one of the projects that I ran, and getting that voice and saying, actually, if we make these decisions, will that work? Are we coming up with solutions that will be okay for the whole community? So thinking about practically, how do we make sure, how do we know what the diversity is of the group? And it depends on what level of group you're decision making with. How do we make sure those voices are heard? Do we need everyone in the room? Do we think about representation? Or do we think about checking back with some of those organisations where they are supporting particular groups' voices? Along the way. But good co-production will try and mirror and get that happening. And reciprocity. We did some work, and it's it was more at an individual levels of co-production. We got some funding from the Department of Health in England to work with different sites and explore how do we help people with dementia maintain the connections and the relationships around them or build new ones. So we looked at the circles of support model, where you think about who does the person want, and thinking families and friends and professionals and bringing all those people together around an individual. And one of the messages that came out, some of the learning, you get little bits from different places, was that actually it's really, really hard to ask for support or to ask for something to happen if you don't feel you're also giving something back. And within co-production, we're setting up a process by which people are contributing and are giving and receiving at the same time. So it allows for people feel comfortable with it because they don't just feel they're in a recipient position or just in a giving position. And that's come out as being really, really important at lots of levels, both in sort of the group and the individual level. Because in a representative setting, if someone's representing all people who receive home care or all people from a particular community, they still bring their own views, don't they? They still bring their own personal experience of that. And it's something I think we have to, I don't have an answer. I think it's something that we have to think about. Is representation going to work, or do we need to do more work with a bigger group that represent those voices to get some of the diversity within them, and then the representative brings lots of voices, or do we assume that the representative can just do that? Some of the ways we've got over that in terms of it's not necessarily just a small group. It can work really well in small groups in terms of one conversation that's going on, a small mixed group. But for instance, in designing what the principles of co-production are, the document and the stuff we just went through, that was lots of groups where we tried to pull together. So we wanted to capture different experiences from across the UK, urban experiences. How does this work in a city or in a country setting, etc. So we had varied groups whose voices were all brought together, and we were able to theme and then go back to all of those groups and say, is this still making sense? How, and so on. So you can do it in that way, but it's a really, really important thing to think about. Working together for change is a really interesting format. When you're thinking about the representation, should we have everybody's views, or should we have representatives' views that we're building change on? And what it allows you to do, if you're an organisation where everybody has CDC and everyone has their own plan, and everyone's already told you, these are the things that are important to me, these are the things that matter and don't, and are things that aren't working and are working. If you've got that information from lots of individuals, how can you pull that together and use it to inform, to see patterns amongst it? So you might not necessarily know if you just ask individually that I don't know, a particular community facility has closed and someone said, all right, I need something to replace that. You might have someone else down the road who's saying the same thing. You might have another person somewhere else. Now, if you're only working at an individual level, at that individual consumer level, you're not knowing that actually maybe what we should be doing, loads of people are saying the same thing, maybe we should be addressing this thing on a bigger scale. So the working together for change model enables you to, and I won't go through it in detail, to take things, the messages we get from individuals, and look at how we can stream those into action planning for bigger change. So it's quite powerful if you want to bring in everybody's voices. And then you work with sort of focused representative groups, but with everybody knowing that you've looked at what they've told you through their planning. Because often, do you get that thing where people say, but I've already told so-and-so, how come you don't know that that's important to me? I said it once. So it enables you to say, we've heard you, and this is what we're also going to listen to this on a bigger scale. There's been quite a lot of work about what does it take, where does co-production work well, what kind of things are going on in organisations or groups where co-production happens really well and is easier to implement. And one of the guides there worked out that it fits within sort of the organisational context, thinking of culture. Think about the beliefs and values of an organisation or a group of people, positive approaches to risk. It thrives more and it's easier to implement when we've already cracked some of those things. But at the same time, if we try it, it also helps the culture change. So when we're thinking of drivers and barriers, and when we're thinking about implementing this ourselves, it's worth thinking about what context am I operating in? Am I working in a sort of a culture of risk aversion? What might I do about it? Am I operating in a culture which is very about power down and about certain people hold power and others at the moment don't make decisions? Sometimes it's worth thinking about what do we need to change before we try co-productions. The organisations that I can see where I think it's become embedded in their culture and they've taken it further are where they've started with some small projects. So they've started with planning around individuals and CDC. Then they've said, all right, let's just pick, we've got this one policy which needs review, let's just try that. And what happens is they gradually start using it more often. And I'll show you in a minute, but one organisation in particular has got to the point where they said, actually, you know what, we can't devise our strategy, our 3-year strategy and our growth strategy, etc., unless we co-produce it. So it's been a journey. They started off using it in a few ways, and then they sort of decide to take it, and it becomes embedded gradually. Within the structure, just thinking about the roles, the policies, the structures, the management, how we plan and stuff at the moment, are we already in a situation where we share those, or are they very much sitting with certain people? If we do co-production and we come up with certain solutions, people have found that sometimes solutions go against what it says in people's job descriptions. It could be really simple little things that you come up with. Well, it says in my job description I can only do that, or I can't do that. How do we get over it? Do we change the job description? We might. So it can have much wider implications, the decisions that are made in groups, that we need to be thinking about. Practices, so organisational practices and things that we're used to doing. Do we have spaces? Do we have access? Do we have communications that work for everybody already? Are we already really good at that? Or is that something we need to shift and look at as we go along? And the importance of review, the importance of learning as you go, and co-producing evaluations. But I think one of the things that in the life of a group, if we think about a co-production decision-making process as a journey, you can do those reviews as often as you like. Some of the groups we worked with checked in at the end of the meeting or checked in later. The facilitator might check in with individuals and say, did that work for you? Was that okay? Did we get that one right? Do we need to do it differently next time when we meet? Was there something we haven't got? So there's almost the having in mind how, not just how we review the outcomes at the end, but how do we review as we go along to make it work? And that was where a lot of the learning has come from. And then people have, been through situations where people have said, no, I didn't feel I was able to speak, or I was too scared to say this thought that I had. Okay, so what do we need to do differently? I haven't explicitly said it, but it can be useful to have an external facilitator. Where you've got somebody who holds the process, particularly if you're working in a culture and structure where the power is very, very set and held and roles are very, very fixed within the organisation. If you've got an external facilitator rather than just leaving those groups together to try and get over those, the facilitator can specifically think about that and bring those voices out. If we work with our staff the way we want them to be working with individuals, and we hear what's important to them, and we hear what's important to teams, that they're more likely to follow on behaviour of listening to others. But the other thing that you could do is you remember that if we are co-producing an organisational decision and issue, staff will be there. We'll be inviting them as one of the many voices to say, what matters to you? You are equal in this as well. So you've got two different ways. You could think about it if you're thinking about getting the staff on board so that they're in their own world, sort of at an individual level, co-producing work, but also thinking about if we've got a bigger picture, we want staff there anyway, and we will be asking them as part of a bigger group. So that's, but you've recognised that workforce, getting them on board by recognising them as equals as well and supporting them. This is a model that I use a lot when I'm trying to think about if I change one thing in an organisation. This is called the 7 S's. It's an organisational development model by some people called McKinsey's, who started out as a person and is actually an organisation. But they describe organisations as 7 S's. And we can look at this in the context of a small organisation, a home care organisation, a home itself, a government, a department, all of those, at whatever level and whatever size we're thinking about. They all will have their own values in the middle. They will all have some staff. They will have styles and approaches to doing things. There will be certain skills available. They will probably have a strategy. There will probably be a structure and different roles, and they will probably have systems like IT and how we do things and communication systems, etc. This is about recognising that if we change one thing, you'll see all the little lines between them, they often have a knock-on effect on all the other things. And so if you're in a situation where you're co-producing a new strategy, what does that do to everything else? What knock-on effect will that have to our shared values? What knock-on effect might that mean we have in our skills, or what lack of skills might we have? That means we need to build up the skill base before we do it. So it's just a way of trying to take a whole systems approach if you're introducing any kind of changed processes and say, either to go back and say, to preempt what might happen, but also to say, there's something going wrong. Is it because one of these things has been impacted or is stopping it happen?